A caregiver gave a double dose of a sleeping medicine. The patient was unresponsive and had to go to the hospital. They did not know the side effects of the medication. Education and training is the highest priority in my clinic. I can train you. Keep listening. Okay, we're talking about the 3-day caregiving challenge. We're going to transform your caregiving journey. Is your caregiving proactive? Have you thought about what to do if they don't take the medicine? You already have it in your mind, planned out. That's our goal. You don't want to wait till something bad happens and then what do I do? They escape from the house. What do I do now? What do I do? Can't think of what to do. I'm panicking. You need to think of your common uh, caregiving situations that are a problem and have a plan before they occur. What is our 3-day caregiving challenge? We're going to use the bond method. We'll transform your caregiving situation. I will treat you the basics about what you need to know about caregiving, bonding with your loved one, optimize your self care, nurture your caregiving team, and document the health assessment. The bond method reduces the training gap, which is the what you need, the skills you need to be a very good caregiver compared to your present skills. The big picture is we treat you proactive training, already have it planned out what you're going to do if they refuse the medicine, they get super angry, they trip and fall. You already have that in your head planned out, or at the beginning you have it written down. You refer to a written plan. The unique bond method that no one else is using. Before the transformation, before the bond method, the giver identifies as someone who's constantly overwhelmed and struggling to keep up with the demands of caregiving. They feel like they're perpetually in crisis mode and cannot find a way to manage effectively. That's before the bond method. After the bond method, the caregiver sees themselves as capable, resilient, and effective. They identify as someone who can manage caregiving tasks with patience and foresight. Their positive identity is reinforced by their proactive habits and structured approach to caregiving. So you want to convert your identity that I'm not sure what to do, I've tried things, it's not working, to an identity that I have a plan for the common problems in my caregiving. There is urgency in caregiving. Tomorrow is not guaranteed. The urgency of caregiving. Did you know that every minute many people develop a heart attack, they fall, new dementia? You need to be prepared for this. Without proper training, caregivers can unintentionally cause harm or worsen their loved one's condition, and they may worsen their own condition. I've had 2 caregivers die while taking care of their loved one. Learn to use a communication board to improve communication in dementia. Learn to do a health assessment in someone with a heart attack. Remember to prevent falls. After one fall, they're more likely to have another fall. Don't be reactive, be proactive. The urgency of caregiving. Did you know that? We're going to review the homework from yesterday. Uh, we talked about describing 3 problems that prevents you from asking for help. We talked about how to create your caregiving team. I can't run the clinic all by myself. I need my medical assistant. I need insurance verifier. I need an office manager. I need a vital signs person. And also the caregiver needs people. Next door neighbor, pharmacist, medical aide, nephew. So please put in the chat uh, a problem you have about asking for help, your caregiver. I'm too shy to ask. I've asked my brother a million times and he won't help. Just put any issues you've had with asking to for caregiver help. I'll give you a few seconds. Uh, Many times caregivers tell me they're too shy to ask. my parent, my loved one is my responsibility, and why should I ask other people to help? Because we need help, and you'll be amazed how people will reach out and try to help you, if they can. Another family member told me, I feel guilty for not being with my loved one 24/7. I feel guilty going to Zumba, feel guilty going out to dinner with my girlfriends. Uh, but you need to do self care. You need to have a caregiving team. Who are some of the persons you have asked to help? Have you asked your nephew, uh, maybe that brother that refuses to come do elder sitting? You can say, hey, brother, can you go to the pharmacy and here's my credit card and pick up the prescriptions? Hey, brother, can you get some band aids? Uh, our loved one fell down. So sometimes men don't want to change the poopy diapers and be close to the loved one that's very ill, but they'll do non-caregiving tasks, fix the bathroom with a holder, call the plumber, things like that. And if your brother or your next neighbor says no, then say, thank you very much for listening to me. Be patient. Don't burn your bridges. Say, okay, and explain why you need help. Brother, I need to take a nap. I haven't slept the last three days. It's not because I'm lazy. It's because I'm gonna have a nervous breakdown unless I take a 1 hour nap. Explain to them politely. If they say no, then try again in a week, in a month. Um, and just put in the chat box uh, things that prevent you from asking for help. I feel guilty. No one's around. I live far away from everyone. Everyone is so negative around me. Just put those in the chat box. If you want to be a private, you can email me response. If you want to do a one-on-one session after this, you could put, I want a one-on-one session in private with Dr. Rare, and I will set that up immediately after this lecture. Yesterday's homework, yes, it's much work, but you need to think about your caregiving situation. Think about the problems you had. The more you think about your caregiving situation, the more uh, you can ask questions and the more you can learn how to cope with the different situations. Uh, here's research. Uh, in this research article in JAMA, very prestigious medical journal, 63 uh, caregivers, uh, people who are caregivers have a 63% more chance to die than people who are not caregivers. People who are providing care, experiencing caregiver strain, had mortality risk. That means dying more often, 63% dying more often than persons who are not caregivers. So caregiving is very stressful. You can go to the hospital, you can get high blood pressure, you can even pass away. Each component of the bond method builds upon the other. You need to practice the four components. A bond with your loved one, optimize self-care, nurture your caregiving team, and document health assessment. Be that person when you walk into a room, everyone recognizes your happiness and your energy because you're fulfilling the four aspects of the bond method. Uh, this is a graph, a figure that I've taken from athletes. There's a lot of similarities between athletes and caregivers. Athletes, they're performing so hard, they're working every day, they never get a break. They know the competition is high. A tennis player, a basketball player, football player, they know if they don't perform to the best, someone else is going to take their place. Same with the caregiver. If they don't perform their best, then their loved one's going to get sick. Their loved one's going to fall. Their other one's going to go to the emergency room. So the caregiver is just working 7 days a week, just trying so hard, to be the best of the best. And so what this figure is showing that you have a high challenge at the top, high challenge job could be caregiving, could be being a tennis star, being a basketball star. Then you have a low challenge where you just lay in bed. That's a low challenge. You don't need practice to lay in bed. Then you have low skills. Uh, you're doing what you're doing is drinking a glass of water. Then you have high skills where you're a caregiver, you're an athlete, you're a mechanic, you're a doctor, high skills. So uh, the caregiver needs to improve themselves from a low challenge just to be reactive to their caregiver, just wait for bad things to happen, and then they do something about it. That's a low challenge caregiver. So a high challenge caregiver that they already have it planned out. If they don't take the medicine, I'm doing this. If they escape the house, I'm going to do this. If they get angry, I'm going to be a calm face. So you want to be in the red letter zone, the ideal caregiver zone, high challenge, and you have high skills. Here's a video about a wife that had positive talk to calm her husband down.
An example of how they're working.
Okay, well, the fact that you always encourage us to be cheerful and positive with our loved ones, even though they've had memory loss and they're negative and difficult sometimes to deal with, we should take the higher road and be positive in our dealings with them and use cheerfulness and positivity to encourage them to get the things that we want them to do done, like taking their medicine or getting a bath or whatever daily activity is required.
Okay, that's awesome. Can you describe a situation where you did this intervention and it was successful?
Absolutely. My husband, Manuel, has memory loss, and so sometimes he is very difficult about wanting to go do his doctor's visits or take his medications. So we use distraction sometimes, and we tell him, well, let's go out to eat, and then we swing by the doctor's office. And by then he's in a better mood, so he'll cooperate a little bit better. Also, to take his medications, he has 2 different medications, and we've convinced him to take one, but the other one he doesn't want it. So we tell him it's the same medication, and so he'll go ahead and take it. So even though it's, not telling him all of the truth, it's getting him to do what's best for him.
Okay, an example of.
More testimonials. Mrs. M refused her medicine. She refused to eat healthy. She was drinking alcohol in her private home. Her medical condition deteriorated rapidly. When the daughter focused on the relationship, the mother was convinced to go to assisted living that observed her closely and eliminated her access to alcohol. Her medical condition improved rapidly. And we're talking about the bond method of caregiving. Bond with your loved one. Optimize your self care and wellness. Nurture your caregiving team. You can't do it alone. Document your health assessment. After the bond method, you're going to use good communication skills to do a happy relationship. You're going to optimize self care. Ask your neighbors and your nephew for help. And then drink water and fruit and vegetables. Nurture your caregiving team, ask your neighbor and your nephew, and then document your health assessment. Then you repeat the process over and over again. Bonding with your loved one, your relationship with your loved one is more important than if your loved one takes their medicines or takes food. Your relationship is the key to happiness. Your loved one's happiness and a calm household can be the result of your good relationship. Instead of using logic, use empathy. Instead of saying, this medicine will lower your blood pressure and prevent a heart attack, don't say that. Say, you're beautiful and young today. Your grandchildren love you. Here's this pill. Please, everyone, put in the chat box some happy compliment that you can give to your loved one. Oh, mom, your hair is so beautiful. Oh, mom, you remember when we went to the park last week? I remember when you went to my graduation. I was so happy that day because of you. How to promote bonding. they refuse the pill, you can say, after you take this pill, let's play some dancing music and look at the photograph album. Remember, don't get angry if they refuse. Just try later. Have a calm voice when you talk to them. Have a calm face. Remember, it's the Alzheimer's talking. Your loved one is not personally attacking you, it's the Alzheimer's that is attacking you and making them angry. Now we're talking about document the health assessment. Documentation, journaling, recording events, blood pressures is a good way to monitor your loved one. You need to document vital signs, finger oxygen, finger glucose, if diabetic. Important symptoms like falling, chest pain, or shortness of breath, you need to document them, the time and the day they happened. And we have forms to give you if you sign up for the training. We will do a health assessment over the phone if you do a VIP session with me or if you purchase the product. Documentation of important events like going to PCP, specialist, emergency room, and the hospital. Documentation is important because sometimes the changes are very small and you don't realize they're coming up. You look at your documentation, oh, mom only fell one time last week, but this time she fell 3 times. Oh, mom was smiling 3 times a day last week, but today she didn't smile at all. Oh, the blood pressure is going up and up every day. The sugar is going up and up. So you need to document that and review your documentation. Here's a form that we give you during training to write down your blood pressure. Blood pressure systolic, diastolic, pulse oxygen, finger glucose, temperature. We teach you in the training how to do all these. And then here's common symptoms. Are they eating? They skipped the breakfast. They ate 100%. They refused. Are they sleeping 2 hours at night? They have pain. What location? Did they take their medicine, refuse their medicine? They have confusion or any other symptom, fever, vomiting. And then here's major events. Patient went to the PCP on this date. The reason for the visit, diabetes. Home health nurse came on this date for a checkup. They went to the Memorial Hospital on this date due to fever and pneumonia. You show these to the PCP, or if you go back to the emergency room, show this, and the doctor immediately can tell what's going on, immediately orders blood test and treatment. Here's the medicine. The medical list is so important. So many people come to my office and say, whatever the computer says, doctor, that's what I'm taking. No, you cannot say that. You need to document your medicines. If you have all these in a list and you go to the PCP will be impressed. Wow, you are great. You're so documented. Are you an engineer? Are you a doctor? The doctor will be really impressed. You'll be a 99 percentile better documentation than all the other caregivers and patients. Here's the health assessment. You put the 3 major medical problems here. Then you put minor. Major is like hypertension, stroke, heart attack. Minor is like rash, mouth pain, little toe pain. You put the vital signs here and the major symptoms like chest pain, fainting, falling. You put the major symptoms, like I said, rash, ulcer. Ulcers are very important to document. Bleeding, vomiting blood, blood in the poo-poo, document that. And then we teach you how to assess the overall situation of your loved one to red, yellow, and green. Red means they have a severe condition 3 times a week, or they went to the hospital or the emergency room in the last 30 days. Going to the hospital emergency room is a very severe condition. Don't minimize that. When that happens, the chance of them going back to the hospital is very high. Medicare has all these guidelines. They tell me, Dr. Rera, please notify us, notify the home health. If someone goes into the hospital, please see the patient after they leave the hospital in 3 days. And Medicare reward the doctors if we see the patient within 3 days of leaving the hospital. That's a critical situation and critical information. Green means no severe symptoms, blood pressure is good control, sugar is good control. Now, patients tell me, well, doctor, why don't you just do all the paperwork? I want to sit here and I don't want to document anything. No, you need to document this. You need to learn the important diseases. You need to learn the medications. You need to take responsible for your own health or your caregiver's health. Many patients come to my office, doctor, you take care of everything. I'm in your hands. I'm not going to do anything. You just do everything for me. No, that's not a good way to be a good caregiver. That's not a good way to help yourself or help your loved one. You need to take responsibilities. The other issue is the hospital can't send the records to you without permission, and the doctor just can't call the hospital, send me the records right away. You have to send a piece of paper. It has to go through the medical records. It may take a week. If you go to the emergency room one day and then the next day you go see the doctor may not find out for 2 weeks what you went. But if you wrote down on Monday what the ER doctor said and you see the doctor on Tuesday, then the doctor knows what's going on. The doctor can order tests. Doctor can give you treatment right away. Sometimes I spend 30 to 60 minutes searching for the records in the hospital, ER. They went to the specialist last week. They went to have some unknown mammogram or x ray, and then that delays everything. Makes it very frustrating when the doctor can't find out the old records. We all need to do paperwork. Do you go shopping without a food list? Do you go to the tax consultant without your paperwork? Do you go get a bank loan? Oh, Mr. Banker, uh, I don't know my income. I don't know my tax loan. Just give me a bank loan without any paperwork. You go to the driver's license office without paperwork. You apply for insurance. Everyone needs paperwork, especially the doctor. Okay, paperwork makes the world go around. Why doesn't the doctor do all the paperwork? Like I said before, the caregiver needs to learn, the patient needs to learn. We all need to learn what the paperwork means, the diagnosis, the medications. Here's a testimonial, Mrs. A. Her daughter had severe abdominal pain, and she saw me. I did a test. I did a doctor's note and a health assessment. She took that to the emergency room. There was a big long line. She gave the list to the check-in clerk there. The check-in clerk gave it to the nurse. The nurse gave it to the surgeon, and then right away they took my patient right to front. The patient bypassed everybody. That's because she had a very serious condition that was documented on the paperwork. Of course, if you have a pinky toe and your health assessment says you have a pinky toe, they're not going to put you in the front of the line. But if you have serious medical condition, severe abdominal pain, they will put you on the line, because of the health assessment. Frequently, every day, 2 or 3 people say, I don't know why I'm here, doctor. So I go through the records and say, do you have chest pain? Oh, yeah, I forgot to tell you I have chest pain. Okay. Are you taking medicine for the chest pain? I don't know. Oh, are you taking medication number 1? Oh, yes, I'm taking that one and stuff. And then I finished the examination. I'm walking out of the room. Oh, I forgot to tell you, I went to the emergency room yesterday. So the patient lost 30 minutes. The doctor could have been focused on that ER visit if you had told them 30 minutes ago, I went to the ER. So this documentation is so important. This homework, we don't have any more days of lecture left, but if you can email me homework, talk about the 3 major problems that your loved one has, and you can email me, text me, I can email you a health assessment. I will respond to you. Also, other than the diagnosis, what are the important symptoms? Your loved one is angry, falling, stomach pain, rash, fever, spilling their urine on the floor in the bed. Text me or email me. Tomorrow is not guaranteed. The caregiver can get sick. The loved one can get sick. This is one of my favorite Helen Reddy songs, You and Me Against the World. Talks about the time when you and your loved one will not be around. Sometimes I think it's you and me against the world. When all the others turn their back and walk away, you can count on me to stay. And when one of us is gone, and one of us is left to carry on. I won't hurt you with my bad voice, but then Helen Reddy says, then memories will have to do. Our memories will get us through. Think about the days of me and you and me against the world. One day, all you're going to have is memories. So get your training today. The truth is, we want you to have your dreams. What's your dream? Go to the beach with the grandchildren. Go to dinner with my girlfriends. Go get a manicure, pedicure. Work in the garden. What's your dream? You need to have a better relationship with the doctors. Be calm and confident about your knowledge. Learn to sleep more. You get help with your caregiving team, and the bond method will result in tangible benefits. Uh, Things that take away your dreams. You try keeping the same thing over and over. You keep shouting, Mom, take your medicine. You better take your medicine. Mom, take your medicine. You keep frowning all day long. Just have a frown and a scowl on your face, and that emotion pushes onto your loved one. You try using logic. Mom, this is for your cholesterol, and your cholesterol will help your heart medicine. Your heart medicine will help your blood pressure. No, you can't use logic. Use empathy and love, compassion. And then if you try going on the internet says one thing. There's 100 websites about caregiving on they're very brief. Each conflicts with itself. Then the TV says to do this. TV says take medicine to calm your loved one down. You know, the pharmaceutical companies, they want you to take pills. They don't want you to use good communication skills. They want you to take a pill. And the home health nurse says the third thing. So the bond method, we are giving you consistent, important information, comprehensive, important information. Dr. Herrera's research will encourage your dreams. It's not your fault that you're having trouble doing caregiving. We all make mistakes. If you make a mistake, you're normal. I make mistakes all the time. It took Dr. Herrera 32 years of experience reading hundreds of books and websites, condense all that information into the bond method. I summarize the information so you don't. Don't worry, we got you. Dr. Herrera's been experienced so many caregiver situations. Almost undoubtedly, the caregiving station you have, Dr. Herrera's talked to elderly about it. Here's another testimonial about self-care.
Carlos, you've asked me to give you some comments on your seminar that I attended a couple of weeks ago on caregiving. And first of all, I really enjoyed it. I thought that the materials were excellent. One of the things I really was impressed with is when people take care of others that are elderly, usually the person that's taking care of the elderly person dies 70% of the time, dies first. That's remarkable statistics. And it just shows you how important it is for the caregiver to take care of himself or herself. And I know you mentioned several natural things like eating right, better sleep, quiet times, devotionals, whatever, for the caregivers to enjoy while they're taking care of their loved one. So I really think there's a lot. Carlos.
Saving money will encourage your dreams. With Dr. Herrera's direction, we can apply for home health services, get insurance to pay for expensive medications. For example, last week, Dr. Herrera with the paperwork, the patient, they wanted to charge for Farxiga, the diabetes medicine, $615, and it was reduced to $350 with the proper paperwork. Ozempic, they wanted $2,800, and it was reduced to $89. So we can help you save money. The bond method can help decrease the gap of what skills you need and the gap between the skills you have. So we're trying to up the skills to be proactive. Small daily habits can have a huge effect of caregiving in the long term. One more smile a day. Yesterday, your loved one smiled once. Today, they smiled twice. You just keep working on that same technique, and over a week, 2 weeks, 3 weeks, they're going to be smiling 5 times a day, 10 times a day. Drink a half a glass of water a day for a week and just slowly build up small little changes, like planting little seeds. In time will be a big bush, in time will be a big tree. Make one phone call to a neighbor a day to build a care team. You called on Monday, the neighbor said no. You called on Tuesday to say the nephew said no. On Wednesday, you told the nephew, I'll build you cookies. The nephew says yes. Just small little things every day. Communication skills are the most important. Validate your loved one's frustration. If they're frustrated, say, I know you're frustrated. I know you're angry. Validate their emotions. Look at your loved one in the eyes. Assess your caregiving situations and have it planned out or write it down what you're going to do if a critical situation occurs. Chest pain, falling, fainting, worsening mental status. The bond method will help you reduce the gap between the skills you need and the skills you have. Many caregivers underestimate the seriousness of my loved ones. I'll ask them in the clinic, how's your loved one doing? Oh, they're fine. Oh, are they getting angry? Yes. Oh, yeah, they got angry. They almost hit me yesterday. Oh, they fell down 3 times last week. They kind of underestimate how how sick their loved one is. The caregiver thinks they're healthy, but they're not. Let me see the blood pressure. Oh my God, the blood pressure is very high. If your loved one has severe symptoms, falling, chest pain, repeating themselves, angry, losing weight, refusing medicines, worsening confusion, then you need the skills of the bond method. Why not purchase online today? How do you know if your caregiving situation needs to be approved? If any of these issues are occurring, you need training today. Getting angry, escaping from the home, falling down in the bathroom, missing doctor's appointments. Do you have caregiver burnout? Some patients, caregivers don't know they have burnout. They have depression, anxiety, crying, lack of focus, can't make decisions. They have no help, no sleep. They're happy 1 minute, crying the next minute. The caregiver doesn't realize what a severe situation they're in. The caregiver is important for the caregiver to see the doctor 4 times a year and to have blood tests as the doctor recommends. Here's another urgency from JAMA, prestigious medical article. Caregivers taking care of their loved ones die 63% more often than persons with the same age who are not caregivers. Caregivers die 63% more than person with the same age who are not caregivers. That's scary. What is the cost to your marriage? Here's a TikTok report that caregiving destroyed my marriage. He was focused so much on his loved one that he neglected his marriage. No, don't do that. Don't neglect your marriage. Don't neglect your children. Don't neglect uh, any other important issue. Don't neglect paying the bills. Uh, you need to look at your whole life and set priorities. Um, are you committed to yourself? Are you committed to your loved one? Are you committed to your family? You need to put the priorities of all this. Your loved one cannot take 100% of your time and effort. Do you have a good attitude every day? You woke up, okay, this is good. I had one smile yesterday. I'm going to try to get 2 smiles today. Do you have a warm, relaxed personality, a warm face? Your face is relaxed, or you are scowling in the morning, Mom, oh my God, Mom, you poo-pooed in the bed. Oh my God, I'm so angry at you for pooping in the bed. No, you need to have a calm, relaxing face. Um, we're going to talk about purchasing training. Reach out to Ray, text to Ray. Um, if you say, please sign me up for a VIP session, please email me, please text me. I want to know more information about purchasing services. Here's another testimonial about Denzel Washington, about caregiver burnout, and you can't do it all alone.
What they start. I'm worried about you. And I think burnout happens when you're attempting to do all of the things you see other people do and not realize that they have deep, meaningful relationships that you can't see, and you think falsely that you have to do it alone. You don't. Everyone needs a support system.
Everyone needs a support system. You can't do it alone.
What they start. I'm worried about you.
Here are the costs of the online training. This is platinum training. Uh, we have a $10,000 package. The value of this is $20,000. Dr. Herrera and his medical team, nurse practitioner, nurse's aide, will go to your house, perform a health assessment, train your caregivers, talk to your PCP, and then give follow-up 1 week, 2 week, 3 weeks, 3 weeks later. This is for people who have a high emergency situation and can afford one-on-one care in your home. The second platinum training we have is $5,000 for 1 year. It's 2 hours a week. For 1 year, the value is $20,000, but we're giving it to you for $5,000. This is for 104 hours. We're doing 2 hours per week because sometimes the caregiver doesn't have 8 hours a day to train. Also, we want feedback. Okay, try this communication thing. Try relaxing your face and smiling. See if that works. And then 2 days later, you begin the Zoom call. Oh, it didn't work. Okay, try this. So we're doing 2 hours a week, trying different things and doing assessments to improve your caregiving situation. The gold training is a $600 value for 1 month. That's 8 hours, 2 hours a week, group online training. If you're a business, we can offer you $5,000 a month for this, a value of $20,000 for training 10 employees. It's so important to have well-trained employees. The better trained your employees are, the better environment the employees have, and the more likely you are to retain them. This is gold training. And then bronze training, we have 399 course. That's 7 hours of pre-recorded lectures. You just listen to me lecturing. If you order it today, we can get you a discount 25% if you purchase by today. Payment plans are available. Divide the payments up into three monthly payments. Please set up a VIP session. You can text me, email me. You can put a comment in the chat. Dear Ray, please set me up for a VIP session or set me up for a phone call from Dr. Herrera. If you sign up today, we will give you a free personal assessment of your loved one. I will call you by Zoom or in telephone and say, what are the 3 major problems? What are the 3 3 major symptoms? What are your medicines? And I will type this up, give you a written assessment, email it to you so you can show it to your doctors that you're seeing. The VIP sessions are to discuss your personal caregiving situation. I can give you practical suggestions and discuss about purchasing caregiving training. What particular problem do you have? Are they answering the same question over and over? Are they angry? Are they escaping from the home? They won't take their medicine, falling. I will give you practical suggestions if you set up VIP call or VIP Zoom meeting. The value of training, yes, you have to pay for training, but what's the value of having a better relationship with your loved one? Smiling 10 times a day instead of frowning, having no more arguments. What's the value? To me, that's a great value. Thousands of dollars. It's priceless. Having time to do self-care, having time to go manicure, pedicure, that's super valuable. Sleeping 1 hour a night, oh my God. If I can sleep an extra hour, that's worth thousands and thousands and thousands. These activities benefits are priceless. Today is the last day to purchase the bond method at a discount. If you have a friend that's interested, show them the link that we gave you today. The recording on Monday, Tuesday, and Wednesday will be put in the Facebook group and on YouTube. You can ask for a link to see these 3 lectures. Please set up a VIP session today. And we will give a $50 Amazon gift. We do have one participant who stayed all 3 sessions. That person knows who they are, and I will email you an Amazon gift card. Why not purchase training today? Tomorrow's not guaranteed. You might have caregiver burnout. It's well documented. The caregiver burnout, the loved one gets worse too. Some people say, Dr. Herrera, I'm a fear of changing things. I've been doing the same thing, for the last 5 years, and I don't want to change. I want to be the way. I'm so guilty about changing. No, the bond method will address your changing, will address your self-care. I am an expert. I'm a Harvard Medical School graduate. I have 32 years experience. Don't feel fearful of taking my course. Don't feel guilty. Act now. Have peace of mind. Have a better quality of life for you and your loved one. Another thing people say to me about my training, Dr. Reda, I'd rather spend the money on clothes for my elderly. Training is just as important as clothes. It's just as important as going out to eat with your loved one. Training helps you daily. It improves your situation over and over. So training is something that can last for you for a year to come. So training is just as important, maybe more important than clothes or other things you spent on your loved one. This training will give you peace of mind, confidence. You know what to expect. You know what to do. Reduce stress, improve quality of life for the caregiver and the loved one. Another testimonial, Mrs. A said, I followed your communicating suggestions, and my husband is calm and agrees to have an MRI of the brain. Is the training worth 5,000 years for one training? Yes, the training will result in tangible items improvement, a calm and peaceful home, better health for your loved one and caregiver, better communication with your doctor. That's worth much more than 5,000. It's worth thousands and thousands. Caregiving can reduce cost by applying for home health services. Dr. will help you with that. Get insurance to pay for expensive medicines. Remember, I got Ozempic to cut down from $2,800 to $89. Caregiver burnout is costly. Who will care for the loved one if the caregiver is disabled? If the caregiver goes to the hospital, you have to pay the hospital deductible. You have to take off work to take care of your loved one. You have to hire someone to care for the loved one and the caregiver. It may take weeks for the caregiver to recover. I saw someone today that their loved one ran out of medicine. So the caregiver said, well, let's see if they can do without the medicine. But no, the loved one got more panicky, started banging on the doors, started trying to escape from the house, got very angry. And so the caregiver had to take a leave of absence from work. He lost all that money because he couldn't work, because at night he had to wake up 4 or 5 times a night because the loved one was getting up, being angry, banging on the doors. And so the caregiver couldn't sleep. So the caregiver lost all that money. Dr. Herrera's training will reduce uncertainty of the future. If you don't have training, what's going to happen with my loved one tomorrow? Are they going to fall? They're going to refuse their medicine? Are they going to refuse an MRI? If you have these planned out, what you're going to do in these situations, then the future looks more rosy. The future looks more predictable. The best way to predict the future is to create the future. The bonding will create a loving, calm future for your loved one and for the caregiver. This program is comprehensive because of the nature of the bond program and because Dr. Herrera will follow up on your progress 2 times a week for a year. The bond method, the bond method will prevent caregiver burnout. I'll end on the transformation of the bond method. The caregiver sees themselves as capable, resilient, effective, hopeful. Their hope for the future will be better. They identify someone who can manage tasks with patience and foresight. Thank you very much for listening. I'm so happy you came. I'm so encouraged with all the people that have texted me and emailed me about their interests. Thank you very much. If someone has any comments or wants a VIP session, please put it in the chat box.